our district, some have highlighted about the profile. We have, as of now, 81 recognized villages. So I'm very sure that to carry out this exercise within 23 camps, it will be a very Herculean task. But I'm sure that, and I have seen that the medical department has been doing very good in the past also. They have been very collaborative with the district administration whenever we call. So it's our assurance and our prayer that district administration, at what possible level we will extend our helping hand. Secondly, I would like to request the civil societies and NGOs, especially the Naga Tribal Council that are present here. They have been playing a very active role in all the activities from before also. And even the student bodies and the youth organization, they have been helping us till date. So I would like to request the civil societies and the NGOs to kindly disseminate this information, because the data which has been reflected today, when we say 1,861, is a very alarming number, what I should say, because like most of us, we don't know the actual status. So I would like to request the NGOs and the civil societies from the district administration side, once we receive the information, we will be disseminating the information to all the villages and the areas where the camp is to be set up. One thing, I may be wrong, but with regard to this very health campaign, I think we should create a little bit of awareness program also, because most of the people who are unluckily affected, they don't come up very much, because like they have been little informed, I would say. In some of the instances when we try to reach the people who are unluckily infected, they are not ready to come because they have not been informed properly. So it will be, I would say it will be the responsibility of the district administration as well as the health department, along with the civil society organization. We should create more awareness so that whatever is planned, whatever camp is to be taken, it can be implemented in a better way.
Likewise, Chumu is predicted to be the next hotspot for HIV and AIDS epidemic unless preemptive measures are taken on a war footing. As per the 2011 census, the projected population for the district is 15,44,010. And those alive, patients alive and on treatment for AIDS as of March 2024 is 1,861. So the breakup will be like this: Jumbukidimat Sadar 1,738, Mezifima Block 74, and Dansari Power Blocks 49 patients. People tested for HIV in the last financial year is 17,162. The general clients 14,783. ANCs, that are the pregnant women, 2,379. The total number of people tested positive during that period is 168. General clients 160, that is 1.1%, and the pregnant mothers 0.3%. Like I was mentioning yesterday in Dimapur, any value above 1% in the HIV perspective epidemic, it is considered a high-risk state. So Nagaland ranks second, yes, second in the country, next to Mizoram. So Chumukadima, when you look at the figures, 1.1, that means it is above the safe level. And who are the people we are targeting? They are the high-risk group with high-risk behavior, like sharing of needles and multiple sexual partners. And they have their networks, their peers, so we are targeting this population. How to reach out to them? It will be by two modes. One will be a static or a fixed site camp where we reach out to the village, to the local general population with a comprehensive service package to avoid the stigma and discrimination. So, Madam has already mentioned the comprehensive service package will include syphilis, TB, hepatitis B and C, and HIV, and malaria. And other services like non-communicable disease will include diabetes, that is sugar, hypertension, BP, high BP, and any other local needs that may arise.
This integrated health campaign is something, it is a tailor-made strategy for all the entire states in India, but basically it's being piloted here in the Northeast, and that is including our Nagaland. And today also, I've been comparing this exercise as a surgical strike. Why am I saying surgical strike? Because what we are going to do now basically is based on classified informations. To a large extent, our organization has very confidential information as to in a specific locality, for example, A, B, C locality, we know how many female sex workers are there, we know how the population of men having sex with men, and IV drug users, and so on and so forth. So this is not for whatever I'm going to share is not for public consumption, but for I would say the privileged people present here. We are going to base this exercise on classified information, as in a sense we will be targeting places where there are a substantial number of this kind of typological people, okay, the population. It could be in the form of injecting IDUs, could be female sex workers, etc., etc. So anyway, here I would also like to acknowledge and appreciate the presence of especially the executives, representatives from the local youth, the NGOs. Actually, this is a very good platform for me to enlighten you on the important role that you all can play, actually, because you are more accessible or more acceptable by the local populace to a large extent. And we are, in short, we are based on 395s, which is a strategy formulated by the National AIDS Control Organization. So by 2026, we intend to achieve the goal. It's a time frame goal. So we intend to achieve this 395s before the year end of 2026. So the first 95 is targeted at facilitating all positive people to know their status. In a sense, we have a large populace, though infected with HIV, are not aware that they are HIV positive. So that we are going to focus on that population in the first 95. The second 95 is based on to put under treatment that component, that positive component of people. And the third 95 is to achieve a suppressed viral load, in a sense to keep the viral growth under control. And yes, so there is a formula that is called U equal to U. So when you have a viral load, when you achieve a suppressed viral load status, the HIV virus becomes undetectable on investigation. And when you have achieved that, when you are undetectable, you are in a reach a status where you are not transmitting the virus to your sexual partner, etc. Okay, so with this I will conclude. But before that, once again, I would like to acknowledge the paramount importance of the involvement of the district administration here. And with this, I wish all the partakers, stakeholders, the activists, and our health personnel all the very best to achieve a grand success. Thank you. As was announced earlier, what the very purpose of the integrated health campaign is to deliver a comprehensive package, not just focused on HIV alone, but then also equal importance will be given to other diseases such as tuberculosis, sexually transmitted infections, etc., etc. And in as much as the manpower is concerned, this is going to be a program launched in collaboration with personnels, health delivery personnels from the parent department, which is the Department of the Health and Family Welfare, and therefore including the personnel from the NGOs and our development partners. Therefore, we are not short of manpower as such. Reaching out to this lost to follow-up group has been a constant challenge. However, especially our counselors, for them it is a routine activity in trying to trace back the lost category of our clients. And in this exercise, we also involve the active participation of our NGOs. And for your information, we partner with a good number of NGOs and development partners. In as much as Nagaland is concerned, we piloted this IHC at Peren, followed by Zonoboto. And now, as you are aware, we are going to already launched here in Dimapur, Niuland and Chumu with the active participation and cooperation of the district administration. So with the experiences gained from Peren and Zonoboto, we are looking forward to having a meaningful output through this campaign.
Welcome to Nagaland TV, Sop Manu Laga Awas. India de Amikhan Laga State Nagaland top to the rank kuri itu HIV AIDS status de. Inaga homoy de Nagaland State AIDS Control with Department of Health and Family Welfare kanba ekta initiative loishe aro ekta health campaign launch kurishe. Itu campaign laga naam to ke sigushikulei do integrated health campaign ase aro itu campaign do joakali Dimapur district de launch kurishe aro aji Niuland or Chumu district de launch kurishe. Ito campaign laga main motive to ke sigushikulei do HIV patients kan ke takana status chanai dibule aro ajikali do itu bimar karne tawai bi olagina ase itu karne patients kan sorom natagi gina hospital de ai gina treatment lowole aro itu virus to under control de rakhibole AIDS bimar ikla noi gina tuberculosis chindo TB bimar bi koi aro HIV aro alag communicable disease kan bi itu campaign na under de ahi goina amian ke janai dishe itu karne moi public kan ki bi kobole mun chato apni ekta AIDS patient ase nolibi suspect ase gushikule to sorom natagi gina hospital de chai gina treatment nolibi test luishe gule to pishi phalo boguina janai tieste ina ase gushikule to amikhan laga state Nagaland bi aha tin de nolibi aha sal de AIDS free state hoboguina janai tieste to aji karne imani aro in the news aro update jani deguli side gibi NLTV moi is a reporter moilong pom with my video journalist Tobi Aimi.
Nagaland TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube and Twitter.